Hello, welcome to the Asian Conference on Psychology and Behavioral Sciences 15th anniversary. This is Dr. Ezra Lockhart, and I'm giving a presentation on a pilot study for manualized therapy for transgender acceptance in religious family. A little bit about me. So I have a PhD in psychology. I'm licensed in multiple states as a marriage and family therapist and addictions counselor with over 20 years of experience. I specialize in mentoring and guiding mental health professionals through their career. I have several influential books, including the Emotionally Empowered series, which I would like you to check out via Amazon. I also am an experienced speaker and presenter on topics like internet gaming disorder, suicidality, and transgender acceptance. Today's presentation of this manualized therapy pilot study, I'm going to go over several things. I'm going to introduce it, I'm going to give you a background, I will take you through the methods, the key strategies and treatment implementation, the results, the discussion, some strengths and limitations and future directions, and then lastly a conclusion, in which I'll go over some of the key findings and the impacts on clinical and theoretical application. So I want to set the tone for this pilot study. It explores the concept of transgender acceptance, which is accepting transgender individuals within religious families. And I applied a brief manualized treatment using Haley's model for effective therapy with principles of cultural humility. And what we know about transgender individuals is that they have elevated rates of depression and suicide, and that family acceptance plays a crucial role in trying to mitigate these mental health challenges. And the study aimed to provide a structured therapeutic approach to enhancing family dynamics, promoting acceptance, and contributing to the well-being of the transgender individual. A bit of background and context, especially for the international community. The study focused on conservative Baptist family within the United States, here in Louisiana, which is the 18th state in the United States. And you can see in the bottom right hand corner some words to help describe what the Baptist religion is. It is Christian based, it is evangelical, which means they do proselytize, they do go out and try to convert individuals. They're very family centered and they're faith driven. The small town in which I provided services has limited access to mental health services, especially within secular traditions. And the Baptist religion has some strong adherence to traditional gender roles, which is influenced again by the religion. So in addressing transgender acceptance, is important to be both respectful and sensitive to these cultural contexts. The transgender and transgenderism, there is some conflict when we talk about religious symptoms or systems. Conservative religious beliefs affirm binary gender roles, which does create conflict, and that most individuals who are anything but traditional gender presentation have the fear of rejection or disownment and are often forced to conceal their identities, which lead to feelings of isolation. And that these feelings of isolation and living inauthentically leads to suicide and depression. So we see elevated rates of suicide in transgender individuals, 40% of which have attempted suicide. High rates of depression, in which 50% of youth report experiencing severe depression. And there's unfortunately some religious discrimination involved that does increase psychological distress in this population. Being accepted by your family is important. It is paramount for your mental health. And when there is high levels of familial acceptance, we see reduced rates of depression and suicide amongst transgender youth. This support systems in itself is protective. So if you have at least one family member who accepts you, it will increase your emotional stability as well as a sense of identity and self-worth, and as well as protect you against negative impact of social stigma and discrimination. So all of this increases positive outcomes in mental health. With this particular family unit, there's an intersection between religious beliefs and gender identity, which we've been discussing, and we see that within these traditional concepts, there's a fixed gender role that is purported to be divinely assigned, so God assigns it, and that creates tension with transgender individuals and identities. The Baptist community has strict interpretation of scriptures, and it leads often to the rejection of transgender individual. So there is both familial and communal conflict, as an individual does not adhere to the divine assignment of gender roles and identities, and that the religious teachings have a strong influence on family values and communication, which again leads to distress and reduced relational closeness of family individuals. Getting back to the study, the main objective was to explore specific strategies to increase transgender acceptance within this type of context using a manual. And that manual is framed within Haley's strategic model for effective family therapy, as well as, again, enhancing it or augmenting it with cultural humility. The methods were mixed, so I had both qualitative interviews and quantitative assessment in order to evaluate the treatment outcomes. And this particular family was recruited given their willingness to participate in the study and the availability of secular support within the community. And as you can see here, the traditional and expected ethical considerations were made. Haley's model is a rarity. We don't see that a lot in psychotherapy and counseling. We don't see that a lot, but I'm going to introduce you to it. It is systemic in its approach, and there are some key stages. So there's an assessment that occurs in which you're attempting to look at the family dynamics and a problem. You're trying to identify what the problem is according to the family. Then you set a goal, you commit to an intervention, you implement the intervention, then you evaluate the effectiveness of the intervention and the progress of the client, which is the family system, and then you terminate as soon as you reach generalizability or abatement or reduction abatement or extinguishment of the problem. Haley's model emphasizes a directive and strategic approach. So what is done is intentional, and we are not passive in the approach. Creating a manual in order to support this family system ensured consistency and reliability and enhanced treatment fidelity. It provided a clear framework for both the therapist and the family unit, and it facilitated effective communication and goal achievement. And due to the insurance and the need for structure and efficacy in the treatment. The treatment plan was tailored for the authorized 6 90-minute teletherapy sessions. Again, Haley's treatment is not common, so let me introduce you to some of the key strategies. There is a strategy or a technique called paradoxical intervention, and that's where you engage the client in the behavior contrary to their goals to highlight the need for the change in the behavior. So an example would be, we're going to encourage the family to intentionally avoid discussing gender identity to reveal the underlying fears. Then there's ordeals, in which you assign a task that requires effort, but are meaningful to the client to foster commitment to change. So I might require the family member to participate in advocacy activities for their transgender child. There is reframing, where we shift the perspective to view issues in a new light, and we promote understanding and acceptance. So an example would be helping the parents see their child's gender identity as a strength rather than a challenge. There is the directive interventions, or we call just directives, and this provides specific guidance and instructions to facilitate progress. So I might suggest a structured family meeting to discuss feelings about gender identity in an open forum. And there's an effective use within Haley's for strategic questioning, where you're using targeted questions to provoke thought and encourage self-reflection. So an example would be, I'd ask the family members how they envision their relationship with the transgender child in the future. So those are the key strategies. Now let me present you with the family. The family consists of interracial, or the family unit itself is interracial, where there is a black father, a white mother, so African American father, European American mother, 17-year-old transgender man, young man, and a 13-year-old younger sibling, which is also a man, and biological male. There's some cultural context here. The family adheres to conservative evangelical Christian beliefs, which significantly influences their views on gender identity and their family dynamics. The challenges that the family faced was the 17-year-old's acceptance and support, including their experiences of bullying, social stigma in both school, the religious community, and the wider community. And the impact on beliefs you can see here is that the traditional views on gender within the religious construct is creating conflict for the child's identity journey and the impact on the family relationship and communication. Let's move straight to treatment outcomes, because after the 6 90-minute sessions, there was significant improvement. So if you look here at table 1, this illustrates the closeness scale ratings that show significant improvement for the 17-year-old, highlighting the therapy's effectiveness and enhancing both emotional bonds within the family and family communication. Table 2 here presents the brief COPE scale, which was used to assess both pre and post. And as you can see, there's a substantial overall improvement in coping strategies, particularly for the 17-year-old, reflecting an increased resilience and adaptability after treatment. Treatment outcomes had several factors. There was an initial emotional distance, in which the pre-intervention closeness scale showed significant emotional distance between the parents and the 17-year-old, in which both parents rated their relationship with the child as 2, reflecting a lack of emotional connection and possibly indicating difficulties in accepting their child's gender identity. There was positive change post-intervention, where we see remarkable improvement. 17-year-old's closest scale, or closest score on the scale increased to 4, out of 5 for both parents, and that suggests that the therapeutic intervention effectively facilitated better communication, understanding, and acceptance of the child's gender identity. Parental support was improved, in which the scores reflected the parents' growing willingness to support their child's gender expressing and identity. And this was likely due to both the reframing perspective and the ordeal therapy. There was a significant enhancement on emotional connection within the family dynamic, in which the 17-year-old positively influenced the overall family dynamic, in which there was in which it fostered supportive environment for both children. And we can also see that it benefited the sibling relationship that increased. Despite the improvements, it's important to recognize that the journey towards acceptance can be ongoing, and continuous support and open dialogue may still be necessary to maintain these positive changes and address any lingering challenges related to a child's identity. But overall, the parent score indicated a transition from initial emotional distance to a more supportive and accepting relationship with their transgender child. It highlighted the effectiveness of this manual in order to increase transgender acceptance through fostering familial bonds. There also was a follow-up assessment at the 3-month mark post-treatment, in which both parents reported significant improvements in communication and support of their transgender child, who's now living as a man, found comfort in ongoing therapy at a metropolitan clinic via teletherapy. So there's now ongoing therapy. And the 13-year-old expressed greater comfort in discussing their feelings, which also highlights the family's strengthened cohesion and commitment to advocacy. So what does this mean in the bigger picture? Well, there was significant improvements in the family cohesion and the coping strategies, in which the family reported enhanced emotional connectedness and better communication post-intervention. The brief COPE scale for the entire family increased from 50 to 70, which indicated enhanced stress management. So the family members developed more effective coping mechanisms for handling stressful situations outside of just the transgender identity potential problem. There was some increased ratings highlighting a shift towards a greater mutual understanding and support within the family post-intervention. Now, this study was novel, and it's novel in its contribution in applying Haley's model. So there's the model application bridged gaps between therapy and the family's lived experience, especially within this particular context. It demonstrated, like the model itself demonstrated flexibility and relevance for conservative families and religious families, in which these strategies were tailored to allow for meaningful engagement within the family's unique challenges. And then this also integrates theoretical models and practical application, paving the way for future research. So the study serves as a foundation for further exploration for therapeutic practices within diverse family contexts. Furthermore, it's important to consider cultural humility and directive approaches. This particular manual facilitated open dialogue by honoring the family's religious framework instead of pointing at it specifically as an issue. The directive approach had clear directive strategies to help the family address sensitive topics more effectively as they navigate complex issues. And clinically, there was an integration of cultural humility in order to provide trans-affirming care through Haley's model, creating a safe therapeutic space, and setting the tone for future application given the manual. I also want to highlight some strengths related to family diversity. So the study focused on a family with diverse identities, and it provides valuable insight into complexities of transgender acceptance and demonstrating how religion, cultural, and gender dynamics intersect within therapeutic contexts. So we gain intersectional insight from this. There's also some geographical relevance within the family strength. Although they were in a small town with limited resources, they were able to find a therapist in order to provide a different type of effective treatment that was able to attend to their unique cultural and regional settings. And then lastly, this emphasizes the interplay of various identities within adaptive therapeutic approaches that, again, respect complex family dynamics, which underscores the relevance and applicability of strategic family therapy to achieve just this. Now, with this pilot study, as many, there are some limitations, and I have those listed here. The study focused on a specific family context, which does provide valuable insight. However, the sample size is small, it's unique to this particular cultural intersection and context, and it might have limited applicability in other social, cultural, and religious contexts. However, the manual itself is general enough to guide you through such sessions. Also, there was short-term assessment, only across 6 weeks, and then 3 months post. There are some self-reported biases in which there's only one therapist, there's no external or third-party reports or behavioral observations. This is, again, culturally specific within this religious context and social cultural context. There also is variability within the therapist training that might use this particular manual, and there might be some engagement challenges as you work with family structures which might be more resistant to change. Well, I thank you for listening to my presentation and being interested, and the references is available upon request.